மனமேனி நலமே நேயர்களுக்கு வணக்கம். எல்லாரும் ரொம்ப நல்லா இருக்கீங்கன்னு நம்புறேங்க. இன்னைக்கு நம்ம கெஸ்ட் ரூம் செக்ஷன்ல நம்ம கூட இருக்கிறவங்க மொரீன் மெக்வில்லியம்ஸ். இவங்க ஒரு ரெஜிஸ்டர்ட் சைக்காலஜிஸ்ட். ஒரு கவுன்சிலரா 30 வருஷம் அனுபவம் உள்ளவங்க. வாங்க இவங்க கூட கலந்துரையாடி கவுன்சிலிங் பத்தின பல விஷயம் பத்தி நம்ம தெரிஞ்சுக்கலாம். இந்த வீடியோ உங்களுக்கு பிடிச்சிருந்தா கண்டிப்பா லைக் பண்ணுங்க, ஷேர் பண்ணுங்க, கீழே உள்ள பெல் பட்டனை கிளிக் பண்ணி சப்ஸ்கிரைப் பண்ணுங்க. Welcome back to my YouTube channel, Manameni Nalame. Today in my guest room section, I have with me a very special guest, Maureen McWilliams, a registered psychologist with an experience that spans over 30 years as a counselor. Join me in conversation with her as she speaks to the different aspects of counseling through her years of experience. If you like this video, please like, share, and subscribe. Take care, keep smiling and shining. Maureen, what would you say, what can you tell us about the difference between coaching and counseling? Because sometimes I think there's a blurred line there, and sometimes one can be misunderstood for the other.
Well, again, some of the coaching is like some of this fake counseling. There are some of the diplomas that these people get in coaching are as easy as paying $100, sending off for the certificate. One place they studied and they said all you had to answer was 6 questions, and then they sent you off the diploma. Coaching historically that they're doing now is actually the psychologist who invented, sorry, can't remember what her name is, but what coaching does, you don't get into underlying feelings, shall we say, but coaching has split off into all these different areas of life. There's parent coaching, there's career coaching, there's personal growth coaching. So there's many different applications that people have made. They usually don't get into the counseling part of it. It would be more like problem solving, I guess is the way to describe it. So let's say I want to find a job, I'm unemployed, then the career coach would be helping with the resumes and helping the person to perfect their presentation style, like when they're being asked questions. So yeah, definitely different. So the difference with the counselor is they would be spending several years studying. Usually at our level, you need a minimum of a master's degree. So that's 6 years, and then you've got practicums on top of that. Yeah, quite a bit of difference. Yeah, there are good coaches though, because I know some also where they've done both trainings, the coach and the psychology or the social work. Yeah.
That's helpful. Maureen, can a friend or a family member be a person's counselor?
Usually they say no, absolutely not, because the dual relationships, if you're getting counseling from a friend or a family member, they're coming in with their own, they know you in one aspect, shall we say. So
in a subjective way?
Sorry, what?
In a subjective way?
Yeah, it can be too subjective where they lack the ability to be objective. And the other thing is you may have to say things, counseling them, that is going to interfere with the relationship that you've got with them. And then you also run the risk of they could be disclosing personal information. Well, we've talked about this for everyday life, and now it's bleeding into this professional relationship. So yeah, they usually say, no, do not have dual relationships. And the other thing is they're not going to listen to what you've got to say. So, another reason, not
because
not to seek counseling for family.
Yeah, sorry, I didn't hear that last bit. I think there was a voice here.
Okay. Yeah, they generally say do not get counseling from friends or family because of all what the foregoing is. Yeah,
exactly right. So it doesn't. So basically, it does not work.
It doesn't work. And the other thing is, whoever's trying to be the therapist here doesn't get a break in terms of if the job just bleeds into their personal life. That's not good for your mental health either.
Absolutely. Yeah. That's a very valid point. which I think both of us can speak through experience as well, right? Yeah. What would you say, Maureen, are some of the barriers that get in the way, other than what we've spoken about? That are there any other barriers that come in the way of people seeking counseling or the effectiveness of counseling?
Well, sometimes people just don't want to do anything. Sometimes lazy. Sometimes there's people who don't want to take any responsibility and just keep blaming everybody else and not do anything, not their own work. Sometimes people are biased or prejudiced in the first place, and so they may. Some of the reasons may be they're not willing to bend a bit and to be a little bit more flexible. Sometimes there are situations where somebody could have had years of therapy with another counselor, and now the new counselor, they just can't get used to the different style. It's like, well, that's a totally different person. So they're not going to be exactly the same. In some situations, there's also cases where timing, it's just timing. It's just not the right time to start anything. Other things, yeah, sometimes it's the choice. Sometimes people want a specific counselor who has a particular religion. They absolutely insist. Like I remember I had one client who insisted that the therapist had to know some passage in the Bible, which I knew, but they wouldn't see anybody unless they had that they were familiar with this particular session in the Bible.
Okay, so client preferences, right? And I think that's okay, but it's about, will they be able to find that person, right?
Mhm.
Sometimes there may not be enough counselors with that match all client preferences. And I'm also hearing, right, key to the success of counseling is the willingness for an individual to go through the counseling process where they're willing to reflect, right, within themselves and make those changes. Yeah, and that's hard.
Yeah,
Internally and making changes hard, for sure.
very true. And then, sometimes, again, depending on their therapist, if their therapist isn't asking questions, shall we say, if they keep agreeing with the client, everything that they do, and they're not challenging them to, what about the other person, how you're treating them? Sometimes that is, that is not going to make the client go well, shall we say. It's not going to fix the problem if the therapist is just blaming everybody else like the client is. And I know somebody who was getting counseling for years, and that person never took any responsibility. It was always the therapist agreed with her. It was everybody else's problem. So not helpful for growth. Yeah.
Absolutely. Yeah, that's a very valid point, right? Does the counselor challenge the client and help them change as well? If the counselor is always agreeable, and of course, validation is important, right? But it has to go beyond that and see, right, where change has to happen. Absolutely. Maureen, what would you say about gender? Does the gender of the therapist influence how effective counseling is? What would you just tell us about gender in the process of counseling?
Well, in my experience, it can and it cannot. I've had people where they absolutely insist, for instance, on seeing a female therapist for different reasons. Sometimes it could be a rape or sexual assault, and their experience with men has all been very difficult and painful, and they would prefer to have the counseling with a female. But I've also seen situations where a male client prefers a male therapist because he thinks that the male will have more understanding of what the situation is. And then you get a certain amount of people who don't care. Just give me anybody.
Yeah.
Mm-hmm. But sometimes there's also, like in situations I know where I've worked, where they may want a particular type of therapist, but when you explain, sorry, there's a waiting list for that particular type of counselor, then putting them in to see somebody else to see if they would feel comfortable with this other therapist. So sometimes that can work too. It's like, again, challenging them to think outside the box. Yeah.
Sure. Thank you. That was very helpful. In terms of myths around mental health, and in your 30 years of experience, Maureen, what would you tell us about how the world of mental health and the field of counseling has shifted and changed? What changes have you seen over these years? And what would you tell us about stigma and the misconceptions around mental health?
Well, changes I've seen in 30 years, because I initially started working in psychiatric hospitals, and the thinking very much was, oh my God, medicine is going to solve all the mental health problems. Just give them pills. That's what's going to solve it. And there just seemed to be more time spent on diagnosing people as opposed to treating them. But again, some of the therapies weren't developed until later. Late 60s, 70s, we started to get into some of the CBT therapies. They never had those previously. And so I would say that that's about the biggest thing, as well as this whole thing about patient rights, and patients should have, shall we say, some determination in their treatment. It's not all top down. Also, I would say trying to put people in the community as much without hospitalizing that, because I know the psychiatric, mind you, I know in England, when I used to work there years ago, and initially, even when the public health system came out, they were not allowed to psychiatric beds. Then they gradually started getting more psychiatric beds. But now now what happens is sometimes that's as much as half of the beds are psychiatric in some hospitals. Other changes that I would say are establishing counseling as a profession, shall we say, where you're getting more people trained in it, as opposed to just giving people pills. Like, I personally started out as a psychiatric nurse, so of course it's different, but I just didn't see any effort to do counseling. It just seemed, give them the pill, away they go, watch to see how they do. There was no training. It was just diagnosing what the problem was, as opposed to what do we do for solutions. So there's been more of a movement also, I see, to keep people in the community as much as possible, because once you get into hospitalizing people, it's hugely costly. In the end, it doesn't solve the problem. The problem is still there when they leave. So this whole thing about normalization, trying to implement people to live in the community as much as possible, that is really huge. Like, continue to live your life as normally as you can, because it creates less problems for the client, less problems for the whole healthcare system. Otherwise, it gets very, very costly as well. So changes in, and then all these new therapies coming on board. I mean, some of them are, how can I say, sometimes there's duplications going on. You can't have something entirely separate all the time. And then copyright. And what else? Sometimes there's a holistic approach taken too. I've seen some of that, and that can be helpful as well, where you're looking at everything, what they're eating, also exercise that they're doing, what their mental health is like. So it's not just isolating one variable. Sorry, I could go on and on. So
no, but thank you. That's so helpful. The fact that it has changed, right? The stigma, where it's all about giving people pills, it creates a lot of stigma, and hospitalizing them versus, as you were saying, right, more community-based supports. And I really believe personally as well that holistic way of seeing a person's mental health, where it relates to their physical health and all the different aspects, right from their environment to what they eat and all the family and spirituality and all these different components, does affect a person's mental health, right? So that holistic view. So would you say overall we are moving towards more of a positive, what do I say, moving forward is more positive and stigma is getting lesser? Would you agree with that?
And thank you for bringing that up, because I missed that. But yeah, trying to normalize some of the things, like, because a lot of misconceptions were, if people have to get counseling, that means that they're crazy. they're really, when the majority of people that you see are dealing with regular everyday problems, you know, they got problems with their kids, or they don't like their boss, or having problems with their husband, they're thinking of splitting up. So, you know, it's just regular, normal people coming through the door for the most part, who may be going through a difficult phase in their life. It doesn't mean to say they have to get counseling for the rest of their life. I'll tell you one misconception people have too is, well, if I go for counseling to talk about my spouse, that's going to change the spouse. No, you have to look at, you have to make changes. You can't change anybody else. You can change your response to that person, but sometimes people kind of want that as well. The other thing is about the normalization and the normalcy of the type of people that we deal with. For the most part, are regular people. There is a small segment of the population, people are truly just psychotic and mentally ill. But I've even had psychotic people, if they're schizophrenic and they stay on their medicine, they can integrate into the community. Yeah. So this whole thing about trying to educate the public about counseling, that's, yeah, definitely they've been trying to make inroads. But like any country, there's still too much prejudice, too much ignorance, too much bias. People think that they don't want it, they don't need it, they may want other people to get counseling. So yeah, so trying to normalize it as much as possible. And there's more TV shows about mental health, you know, shows like Dr. Phil, for instance.
Yeah.
And yeah, so more people talking about it, being more open.
Yes.
Oprah Winfrey show used to get quite a few issues about mental health there. So all this normalizing it, bringing it out into the open.
Yeah. What I'm also hearing, Maureen, is like mental health is on a spectrum, right? And someone may be navigating more towards the other end of mental illness. And even if that's the situation, we don't need to isolate someone. We still need to look into ways of integrating them into society and community and supporting their recovery.
Yeah. Well, you explained it very well.
Thank you, Maureen. Maureen, give us some mental health tips in general to our audience.
Well, just a cliche, think positive. That's so important.
That is.
Balance. Right? Yeah, making sure we've got adequate time to exercise every day, to think positive. I'll tell you another change that I've seen in the counseling is more normalization, like integrating meditation into counseling and mindfulness. That's so important for just calmness and stability. Yeah, very important. Yeah, you never used to see that. So that's seen as a tool to use now, meditation.
Meditation and mindfulness, right? And why would you say in today's day and time that is so important, Maureen?
Well, because it's a service that you could implement in your everyday house. You don't have to go out to see your counselor to do meditation. It doesn't cost anything. There are a number of meditations available. You go to YouTube, there's tons of stuff there. The important thing is practice, practice, practice. I've had some clients where you try to do meditation with them, but they want instant results. I think it's just the way our society is built. Everything.
Exactly.
And meditation is like a skill, like the piano. If you want to get good at it, you got to do the practice. Hey, meditation is exactly the same, because when you start meditation and then you evaluate what difference it's made after 6 or 1 year, there's a difference if you are consistent with it. Yeah, that's very important. Yeah, hugely important.
Thank you so much, Maureen. Is there anything else that I have not touched upon that you would like to share with our audience before we close?
Well, I think you did a wonderful job of trying to summarize. I think I got a bit off on tangent on a few things. So I thought you did a very lovely job of just summarizing and drawing things together.
Thank you, Maureen. Thank you so much. Thank you so much, Maureen, for joining us today, for taking the time to late in the evening to share your very valuable, rich experience and expertise with us. And my hope is that it does break down the stigma around mental health, and it helps people come forward to seek counseling to lead better lives. Yes. Right? So thank you so much. Thank you
for inviting me.
Yeah.
If you like this video, please like, share, and subscribe. Take care, keep smiling and shining.